Nerves of the lower limb includes the femoral nerve, obturator nerve, sciatic, tibial and common peroneal, superficial and deep peroneal, posterior tibial nerve, and superior and Let's start with the femoral nerve. Femoral nerve originates from the ventral primary lemma of the second, third, fourth lumbar nerves. Their dorsal division. However, the ventral division will give rise to the obturator nerve. Femoral nerve enters the lower limb by passing deep to the inguinal canal. It lies outside the femoral sheath. It gives muscular branches to the sartorius muscle, quadriceps muscle, pectineus and iliacus. It gives two cutaneous branches, medial and medial cutaneous nerve of the thigh, supplying the lower third of the medial aspect of the thigh, and the intermediate cutaneous nerve of the thigh, supplying the front of skin of the front of the thigh. And also it will give a saphenous nerve. This saphenous nerve is a very long nerve. It will pass through the femoral triangles and descend to the subsartorial canal, piercing the deep fascia to run on the medial surface of the leg and medial border of the foot till the base of the big toe. It will supply the medial aspect of the medial border of the sole of the foot till the base of the big toe. Obturator nerve also arises from ventral primary lemma of the second, third, fourth lumbar nerves, but the ventral division, not the dorsal division. It will enter the lower limb by passing through the obturator canal. It will give muscular branches to the adductor group, gracilis and adductor longus, adductor brevis and pubic part of adductor magnus, and obturator externus muscle. It will give cutaneous branch to the skin of the middle third of the medial side. The sciatic nerve is one of the terminal branches of the sacral plexus. It arises from the fourth, fifth lumbar nerves and is first and second and third sacral nerves. It will pass or enter the lower limb by passing through to the gluteal region, passing through the greater sciatic foramen deep to or pleura piriformis muscle. Then it will run on the back of the thigh. Then it will divide. It is covered by, and the gluteal region is covered by gluteus maximus muscle. It will be divided into a tibial nerve and common peroneal nerve, and its division is variable in the lower part of the thigh, middle part of the thigh, or even in the pelvis. And when it divides in the pelvis, the common peroneal nerve will pierce the piriformis muscle. However, the tibial nerve will pass below this muscle. It will supply the hamstring group, the semitendinosus, semimembranosus, ischial part of adductor magnus, and biceps. They appear in the popliteal fossa, tibial nerve bisecting the fossa from the superior angle to the inferior angle. However, the common peroneal nerve passing on the upper lateral boundary on the biceps femoris muscle. Tibial nerve, its termination at the lower border of the popliteus muscle. It will continue as posterior tibial nerve. It will supply the superficial group, gastrocnemius, soleus plantaris, and one of the deep flexor group, popliteus muscle. It will give sural nerve, and this sural nerve will supply the skin of the lateral side of the foot and lateral side of the little toe. It will give 3 genicular branches. The common peroneal nerve will be divided into superficial and deep peroneal nerve at the lateral side of the neck of the fibula, and it is important relation here because fracture of this neck of the fibula will cause injury of this nerve and its two terminal division, leading to foot drop. It will give no muscular branches in the in the popliteal fossa. However, it will give lateral cutaneous nerve of the cuff and sural communicating nerve, and also 3 genicular branches. Let's move to common peroneal nerve and its two terminal divisions. The two terminal divisions, one of them is called superficial peroneal nerve or musculocutaneous nerve, the other one deep peroneal nerve or anterior tibial nerve. The superficial peroneal nerve supplying the peroneal group, peroneus longus, peroneus brevis. It will supply most of the skin of the dorsum of the foot, this orange area. It will supply also the skin of the second, third, fourth interdigital clefts and the skin of the medial side of the big toe. However, deep peroneal nerve supplying the anterior compartment of the leg, the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius, and it will supply also the muscle lying on the dorsum of the foot, extensor digitorum brevis. It will give cutaneous branch to the skin of the first. The posterior tibial nerve, this is a continuation of the tibial nerve at the lower border of popliteus muscle, midway between the medial malleolus and calcaneus. It will be divided into medial and lateral plantar nerves. It will supply the deep flexor group, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. It will give also a branch to soleus muscle. It will supply the skin of the heel of the foot by calcaneal branch. The medial and lateral plantar nerves will enter the sole of the foot, supplying the whole muscles of the sole of the foot. Actually, all of them supplied by lateral plantar, except four muscles. Two in the first layer, abductor hallucis and flexor digitorum brevis. One in the second layer, the first lumbrical, and one in the third layer, flexor hallucis brevis. All other muscles are supplied by lateral plantar. Regarding the cutaneous innervation, the medial plantar is supplying the medial 2/3 of the sole of the foot and medial 3.5 toes. However, the lateral plantar supplying the lateral third and the lateral 1.5 toes. 1.5 toes. This is all about the overview about the nerves of the lower limb. Don't forget about the superior gluteal nerve, and inferior gluteal nerve arises from the sacral plexus. Superior gluteal nerve supplying three muscles: the gluteus medius, gluteus minimus, and tensor fasciae lata. However, the inferior gluteal supplying only one muscle, which is gluteus maximus. Injury of the superior gluteal nerve will cause if it is unilateral, will cause lurching gait. If it is bilateral, will cause waddling gait. And